Idaho prides itself on being a leader, but that's not necessarily the case when it comes to abortion laws. Anti-abortion activists are trying to model a new law after one already in place in Texas, but it's not that easy. Buy a 50-year-old home? It's bound to need some work. Layers of wear and tear. Not to mention the layers you didn't expect to find. Nearly 2 full years into the COVID-19 pandemic, a week into Idaho's second stretch of hospitals operating under crisis standards of care, and for the 4th time, the Idaho National Guard has been called on to help. It's a deployment of nearly 600 guardsmen and women. Most of them, 503, will assist hospitals overwhelmed with COVID patients and outbreaks among staff, something they've done before. And where positivity rates among those being tested, like within the St. Alphonsus health system, it's gone from 20% at the beginning of this month to 46% a week ago. It's down slightly this week to 41%, but still a far cry from the 5% we are aiming for. This time, the governor specifically activated 75 Guard members to work with Primary Health and the Idaho Department of Correction. Primary Health has 26 urgent care clinics around the valley, and they have been hit hard by COVID with staffing shortages and overworked employees. As recently as last weekend, they had to close 7 of those clinics completely, and they closed all the others early. Today, they have 26 people out, either sick or exposed, and they have 4 clinics closed. Just 4% of staff is out is an obvious improvement, but Dr. David Peterman, Primary Health CEO, says help is still needed and welcomed, saying they can't thank Governor Little enough for this help. Even with 96 to 97% of their staff vaccinated, Omicron knows no bounds, he says. Dr. Peterman went on, by activating the National Guard, we can test, evaluate, and treat even more people seeking COVID care. At the same time, freeing other healthcare staff to help patients needing non-COVID care, like the other illnesses and injuries that happen on a daily basis. So the Guard will be in a sort of triage role for Primary Health and handling COVID testing, freeing up the rest of the staff to focus on their other patients. That will also mean reopening clinics and a return to normal operating hours. The positivity rate they are seeing at Primary Health is about 38% right now. Meanwhile, at the Department of Correction.
As of this morning, I have 201 staff in the Department of Correction who are either out with COVID or who are out because of a direct exposure to someone else who tested positive. So you add those 200 staff that are no longer available to report with an already significant staffing crisis, and it's a situation that's just not tenable.
That's Director Tewalt speaking to the House Judiciary and Rules Committee this afternoon, telling them 10% of his staff unable to come to work today, and why this latest development is warranted. The Guard will be used at 3 prisons south of Boise in supporting roles, passing out meals, helping with counts, that kind of stuff.